October is Breast Cancer Awareness Month. That means that we need to be talking about breast cancer because it's the most common cancer among females. And today I have with me Dr. Annie Kanchan. She is an assistant professor and medical oncologist at St. John's Medical College and Hospital, Bengaluru. Ma'am, welcome to the show.
Thank you.
And I want to start off with asking you, what are the causes of breast cancer?
So, breast cancer, as you rightly said, is the most common cancer in females. We cannot really pinpoint and say this is the cause, but probably it's a whole lot of causes together that lead to breast cancer. So, it can be divided into genetic causes, it can be hormonal causes, as well as lifestyle changes, which is very much playing a big role in today's era, because lifestyle changes have really increased the incidence of breast cancer in today's world. So if I have to actually divide and say, we cannot really pinpoint, but there are different mechanisms by which the DNA damage happens. That can be due to genetics, by which they have a strong family history, they have some mutations present, so that is genetics. Then there are some hormonal imbalance when they have overexposure to estrogens for a long time, and of course the lifestyle habits, sedentary lifestyle, eating habits, obesity. These together actually have increased the incidence of breast cancer.
And what are the risk factors that are associated with breast cancer?
So the risk factors can actually be divided into two: modifiable and non-modifiable. So non-modifiable is not in our hands. Females are at a risk. So age, as a female ages, they become more prone for getting cancer. Then there is something, like I mentioned earlier, family history. Like if a lady has history of breast cancer or ovarian cancer in the family, then they tend to have something called BRCA mutations that are present. So family history is again very important aspect. And of course there are different genetics, this mutations. So these are non-modifiable risk factors. So what is modifiable that we can actually do? So one thing is obesity. Be active, have a healthy weight, eat well, don't have too much of junk food, which may cause the obesity to go up. And then of course be active, go for your runs, and alcohol smoking again. Okay, so this is something which it is in our hands. We can always do our best to curtail all these risk factors. So this would be the modifiable risk factors.
And what are some of the most common symptoms of breast cancer?
So generally what the patients present with, they say, I just noticed a lump in my breast. Sometimes they say that there are skin changes, it has become red, it has become itchy, or there is something called nipple discharge, sometimes bloody nipple discharge, asymmetry of both the breasts, and sometimes armpit, the lady may actually see a swelling that is present. So these are the common signs and symptoms which the breast cancer may have.
And how is breast self-examination done?
Okay, so this is very easy for a lady to do. First of all, whenever she has a bath, she should see in the mirror, is my breast on both the sides symmetrical? Meaning, is there some one is up, one is down? Is there any lump which is more full on one side, or there are some skin changes? So one is standing in front of the mirror. She should see if there is some asymmetry, and of course during the bath she should always check whether there is lump which can be felt, which was not there earlier, and they should do during their initial time of the cycle. So all of the females have the cycles. It is advisable to do it 7 to 10 days after the period starts. So you can just fix probably once a month and see if there is something asymmetry which is present, any lumps which are coming up. Don't ignore any discharge that is coming. So these are some of the breast self-examination that the females can adopt.
And how do you do early detection of breast cancer? Is there any screening, or is there what is the importance of it also?
Yeah, so just like the ladies also should be aware that first the breast has something abnormal by doing this self-examination. So these self-examination, like I mentioned, in front of the mirror, during the shower, they should see if there is something, lump bumps which are coming. This is breast self-examination. Second is when they come to us, when they have these symptoms, they come to the doctor, we go and do a mammography. So mammography is advisable in ages more than 40. And if it is less than 40, we should do an ultrasound. So once that is done, and if there is some confusion happening in mammography, we go in for an MRI. So that's how the screening is done. MRI generally is done in a very high risk patient who have a very strong family history. So this screening is important because after 40 years, generally we tell to get the screening done. Why? Because sometimes you may not have a lump. You may not feel the lump, but it may be picked up on a mammography as some abnormal thing, which then needs to be biopsied. Because early detection and early stages is entirely curable. That is the importance of screening.
So that was my next question. They say early detection of breast cancer is curable.
Yes.
I want to ask you how.
Yes. So when you detect them early, it is typically in a stage 1 and stage 2. Okay, so stage 3 and 4 are locally advanced, that is more advanced. So why do we do the screening? So that we may detect them in stage 1 and 2, and probably just a surgery maybe enough. And many of them will be getting cured just by surgery, more than 90%. Depending upon the hormonal stratification of breast cancer, we divide them as hormone positive, hormone negative, or HER2 positive. But still, with surgery, your targeted therapy, chemotherapy, radiation, you have cure rates of more than 90%, which is quite a lot. That is the importance why we say that you should detect it early, because it is highly curable.
Wow, this is very hopeful
Yes.
for us, I think. And I want to know about what are the different treatment options that are available for breast cancer.
So there are 3 different modalities by which we treat breast cancer. Primary important ones is the surgery, where you remove the lump. Second, so surgery is very important. You have to remove the lump. Second is radiation if you conserve the breast. So the surgery is divided into breast conserving surgery, or you remove the entire breast. But when the breast cancer is detected early, probably we'll go in for breast conservation surgery. So in that case, we do surgery followed by radiation. And of course, our systemic therapy, that is the chemotherapy and the targeted therapy. And with the targeted therapy, newer advances coming in, all the survival rates have really improved. So if I have to bottle down and say surgery, chemotherapy, radiation. So these 3 are the modalities by which we treat breast cancer.
Thank you, doctor. And finally, I want to ask you, what is your message to women and female body people?
So early detection saves lives, I would say. Why? Because knowledge is power, and your health is your biggest treasure, which I would say for the females. So let's break the stigma of not asking for help, of not being educated. Let's be more aware of our own body, what is going abnormal, because seeking help always is helpful in long run, because remember, breast cancer is curable in early stages.
Thank you so much, doctor. Breast cancer is indeed curable if it's detected early. That is Dr. Annie's message. And this October, let's talk about breast cancer. Let's spread the message, let's spread the awareness, and let's not shy away from dealing or talking with subjects like this. I'm RJ Deepthi from Radio Mirchi. Take care of yourselves and your loved ones.